No two births are the same. No two babies are the same. No two siblings, pregnancies, and births are the same. No two anything. When it comes to birth and pregnancy and babies, they're never the same. Okay. What's going to work for one's going to be a disaster for another. And that's the truth in every aspect of pregnancy, birth, labor, parenting, everything. Okay, so it's a very, let's see, intuition based thing, to find a successful thing that works for you when it comes to birth or labor or parenting or any of that kind of things. You're gonna have to try several things most of the time to figure out what works for you, because what works for you this pregnancy probably won't work for you in the next pregnancy. Like, it's the biggest consistency with birth and parenting and pregnancy and labor and all of that is that nothing's consistent. That is the consistency. So knowing that, I mean, we can do the best we can. You know, there are a lot of things that work for a lot of people. There are a lot of common factors that, you know, are that the majority do well with. There are things that, you know, we can prepare ourselves to the best of our abilities to get the best outcome for everybody and everything in all of these stages. But that being said, you have to look at our OB system and what we usually end up in, and which is what we usually end up in, because especially here in America, there are places where, well, I'm not sure if there's places now. I should really brush up on that. My daughter is a year and a half old, not even yet. And when I was pregnant with her, midwifery was illegal. So in my state. So there are places like that where we haven't had a whole lot of options to us, but the OB system. And thankfully that's changing, which is wonderful, because and the OB system can be good. Okay, I don't want you to think that I'm anti-Western medicine, or which I get accused of sometimes, or like I think that these things aren't good. They are. They can be. I just think that, or know that they are a little conveyor belty. Okay, and what I mean by that is that no matter what kind of pregnancy you're having, you get subjected to the same exact tests, the same exact procedures, the same exact everything as everybody else. And from a equality standpoint, that sounds great. But a lot of these tests that they're doing for preventative measures actually end up causing more harm than good in your standard, healthy, perfectly going on normal pregnancy. Okay. Because when you're testing everyone, for one, the statistics show that testing everyone, you would have to test, like, I don't know the numbers, but it's somewhere around like 5,000 people. You have to test like 5,000 people to save like one baby. Okay? From these super rare complications. We're testing people for things that aren't nearly as common as it seems that they would be with our testing, right? Everybody, you know, for the gestational diabetes test, for example, when you go in for your sugar test, you have to drink the drink, and then they test your blood sugar in like an hour. And the fun part of that is that most people fail it for various reasons. And like I could probably do a whole blog post on the gestational diabetes test in and of itself. And my experiences with it and the research I've done and all of that. But anyway, point being, it's relatively uncommon to actually have gestational diabetes. And most people who get diagnosed with gestational diabetes already had underlying factors that before pregnancy that could lead to diabetes later in life. And pregnancy just brings them out because we're testing for it for one, but I'm not sure if it just like brings it out anyway. But anyway, point of story. If you get diagnosed with gestational diabetes, what that means is the only reason they're testing for it is because it could lead to bigger babies. Okay, bigger babies mean a higher risk of shoulder dystocia, where the shoulder gets stuck in the birth canal. It can lead to unplanned cesarean sections. But that's about it. It's not like this overwhelmingly terrible thing, okay? I mean, it's not great by any means, but the way they test for it and the way they push it and the trouble you have to go through with it causes a lot of problems too. Because, for example, when I did the test when I was pregnant with my son, it was so much sugar that, for one, I try to avoid anyway. So my body's totally not used to that amount of sugar. It ramped up my anxiety really bad. So I felt like I was going to pass out. I was sweating. I was trying to contain a panic attack, hyperventilating kind of like quietly. I had to leave and like pace outside back and forth just to keep myself like okay. And of course I failed it. And then so all of that causes stress, and stress is terrible for the baby, which can cause preterm labor and low birth weights, which can lead to all sorts of bad things when babies are born too early and too small with underdeveloped organs and whatnot. But anyway, so I had to go back for the 3-hour test, because that's what happens if you fail the 1-hour test. You have to go back for the 3-hour test, and you have to repeat the process all over again. And the vast majority of people who have to repeat the process, because like I said, a lot of people fail the first test. It's very common to fail the first test. The second test you go back for, and you have to chunk out like 4 hours of your day to go back for the second test, and most of those come back fine. And so these tests can be good if we're targeting the category of people who are more likely to be diagnosed with gestational diabetes. Instead of it just being a one-size-fits-all, we should test everybody, there's underlying risk factors that are really easy to screen for, that we should be put off into a category of high risk or low risk pregnancy. And this is not a video about what's right and what's wrong and the corruption, or I don't even know if corruption's the right word, the misleading things that we do in the standard OB system by any means. The purpose of this video is to tell you that you have choices, and to encourage you to do your own research on, there's no way you can research every possible thing in pregnancy and birth, but when you have the gestational diabetes test coming up, because these things a little ahead of time, just find you a couple of articles to read. I have a resource library that can get you some evidence-based websites that are beautiful with their statistics and their resources citing with their citations to actual evidence-based research, okay? And you can make your own decisions, because that's what we want. You to make your own decision, you to be your advocate for the care you receive and your baby receives in this process, because we want to avoid any unnecessary, stress and complications. There's a word, I wrote it down. But it means the nocebo effect. Okay, so most people know what the placebo effect is. This is the nocebo effect, and what that means is the nocebo effect is unforeseen consequences of things meant to prevent bad things. That's a terrible botchy description of that word, but unforeseeable consequences that come from things that are supposed to help. And an example of that, when I was pregnant with my daughter, I had an ultrasound, like we do, completely standard ultrasound. And side note, these ultrasounds aren't just for fun. Sure, it's fun to see baby, but the ultrasounds are there for the purpose of looking at the baby and making sure there's nothing wrong with the baby, or seeing if we can find anything that's wrong with the baby. And so the doctor's always doing ultrasounds for a reason, and it's never just because. And oftentimes they don't tell you what they're looking for or anything, because they don't want you to worry. They don't want you to think something is wrong where it's not. And so they're not like purposefully lying to you or anything. I don't want to like cause any mistrust, but there's reasons to everything that is done in the OB system, and you just have to be aware of that. So anyway, back to the story. When I was pregnant with my daughter, we had a scheduled basic standard ultrasound, and a spot was found on what they thought was her kidney. So this escalated into a whole nocebo catastrophe. I don't even call it catastrophe. It was super stressful, and we had to go to a specialist who dealt in high-risk pregnancies. Like, that's all they did, was deal in high-risk pregnancies. So now being who I am, I'm researching all of the things that could cause a spot to be on a kidney in utero, and what that means. So I was convinced that she probably had Down syndrome, and I was convinced that the tests are going to come back this. So I was preparing myself for decisions I was going to have to make, and the life I was going to have to lead, and it was just a very stressful time. So I went to the specialist. I sat through an hour-long ultrasound for them to look at and detail every organ in her body, every limb, every finger, everything. And it was stressful, to say the least, especially because ultrasounds already kind of make me uneasy, because we lost a baby first, and the last ultrasound picture I saw of that is kind of still like scorched into my memory. And so ultrasounds are already like in and of themselves a little traumatizing for me and unsettling. So to sit through this hour-long ultrasound where they were specifically looking for something terrible wrong with my child was stressful, and that causes harm. And we had to go back a second time to the specialist also. Kind of find out it was not a spot on her kidney, but they were pretty sure it was an ovarian cyst. So my poor child had to deal with female problems before she was even born. Bless her heart. And it wasn't a big deal. So he said that he sees it in about 3% of pregnancies a year. So not super rare, but uncommon, and nobody really seemed to really be worrying about it. And then we kind of like fell off from there, like, and nobody seemed to care after that, and we were left with a lot of unanswered questions. Should we worry about this? We brought it up to the pediatrician in the hospital when she was born. We brought it up to her pediatrician a couple of months later, or a couple of weeks later, whenever we saw her. We brought it up to a bunch of people, and everyone was like, oh, huh, well, that's weird. And that was about the extent of it. So I guess it's fine. She seems fine. Everybody was like, I mean, if she seems fine, everything's fine. I was like, okay, well, everything's fine then. And we went through months of stress and anxiety and unknowingness and everything just out of a standard test that, you know, the nocebo effect caused all of these other things. And I'm not saying, you know, these things aren't needed and stuff, but honestly, if you're a normal, low risk pregnancy, do your research. Please do your research, or hire a doula who knows all the research and can answer your questions and do the research for you and just guide you through making the decisions for you, because you can deny anything that you want. You can say no to whatever procedure you want, any test you want, and that's totally 100% unique to like whatever your choices are, your informed choices are, because always do your research and always take it upon yourself to take your health into your responsibility. Your doctors should be your teammates in health. You know, you should all be a team, a group with one common goal of keeping everyone healthy. And doctors 100% have that in mind. Surely, I think. Yeah. Yes. But most people don't take any responsibility for their own health in that, because doctors are just people. You have to think of that. Doctors are just people, and you are one of like 300 people they see in a month. I'm just throwing a number out there. I don't really know what it is. Probably a lot. And you can't expect them to have all the answers to every single thing. So they're just running you through all of these tests, and they're doing the best that they can with what they have available to them at any given moment in a lot of ways, just like everybody is. So it's up to you to take your own health into your own hands and, you know, make informed choices, know your rights, know what's happening to you and your baby, and hopefully try to avoid some of these nocebo effects, because which, you know, you have to weigh the pros and the cons on your own for all of that, because you're an adult and make all your own decisions. And but yeah, got a little excited about all of that. Yeah, that's about all I have going on with that I can think of. Make your own informed choices. Tests are great in some pregnancies. In other pregnancies, they cause unneeded stress, anxiety, and complications. There's totally a thing where ultrasounds have been done. They've said that the fetus is unviable. It's got, you know, it's missing a brain, or it has some terrible other horrible thing that's wrong with it, and it won't live past gestation, or it won't be born alive, or, you know, like all of these terrible things do happen. Don't get me wrong, they do happen. But there are also cases that have happened where the parents were told this, they made the choice to abort, the baby came out nothing wrong with it, so they aborted a completely healthy baby. Not that I'm trying to scare you, okay? I'm not at all. I'm trying to help you be aware of things in the world. And unfortunately, there's a lot of fear around birth, simply because it is a hardcore, raw factor of life and death, okay? And it's just a fact of life. It's just a thing. It's a beautiful thing that can be scary, okay? But it doesn't have to be. It's not always. And scaring you is not the thing I want to do at all. But here's all the information. Do with it what you will. And let me know if you have any questions. And yeah, resource library. I'll probably link that around here down below. And yeah, ask me your questions.